Hey folks! Today I wanted to share a practical real-life example of some teaching strategies and learning theories as applied to health professions education. And these are topics we've been discussing this semester in the course I'm currently teaching. And I wanted to share a really practice-based example from my own work as a researcher, which is on electronic consultations. And I think talking about eConsults and learning is a really interesting way to highlight how learning doesn't occur just in formal educational settings. And this may seem like a little bit of an unconventional topic, but I'm hoping today that I can convince you that not only does learning occur through electronic consultations, or eConsults, as I'll be calling it, but they also give us some really valuable information as health professions educators. And I hope that this will also get you thinking about your own practice, whether you are a healthcare professional, a teacher, an engineer, a biologist, and get you thinking about some of the informal learning that occurs within your own workplace, whether it is intentional or whether it is unintentional. So what are we talking about today? Well, first I'm going to introduce what an eConsult is, and then I'm going to introduce the idea of learning from eConsults, and we're going to explore a couple of teaching strategies we've already discussed in my course, experiential learning and reflective practice. And then we're going to conclude things by talking about some broader implications for educators. And I'm really going to focus on the realm of continuing professional development here because even though I teach in a master's program, my research is actually on continuing professional development. But before we dive in, a couple of disclaimers. First of all, my PhD is on this topic, so I do have a personal stake in it. Specifically, my PhD is looking at how primary care providers learn from eConsults, specifically within a rural context. And second, I am also a member of the research team with the Champlain Base eConsult service, which is an eConsult service based in Eastern Ontario. However, I am not directly employed by them. I have had some research contracts in the past to do work with them, but these have all been handled through University of Ottawa, so payroll, HR, everything through U Ottawa. So in short, I am not paid by them or pressured by them to say nice things about Champlain Base. Now, you may be wondering, what the heck is an eConsult? And I know for certain that some of you are already very familiar with eConsults, so if this applies to you, just skip ahead to the next chapter. For those of you who haven't heard of eConsults before, hi, let's talk about eConsults. So eConsults are short for electronic consultations, and they're a type of telemedicine that uses telecommunications to link a referrer to a specialist consultant, and it allows the specialist consultant to provide patient-specific advice directly to that referrer. So these aren't abstract, broad clinical questions that you might see on a forum. These are very specific to that particular patient, and they do include patient information. So therefore, any advice that the referrer, or usually a primary care provider, is receiving back from the specialist, while potentially transferable to other patients, is very specific to that patient. So eConsults, the way I'm discussing them here, are provider-to-provider services, unlike some types of telehealth systems you'll see that connect the patient directly to the healthcare provider. And here, the referrers that we're talking about are usually primary care providers, or PCPs, as I might slip into calling them throughout this presentation. And primary care providers include family physicians and nurse practitioners quite commonly, but it can also include others like pediatricians and physician's assistants. And here, when we're talking about specialist consultants, we're usually talking about medical specialists like dermatologists, psychiatrists, endocrinologists, orthopedic surgeons. Sometimes on some of these services, you'll also see family doctors registered as specialists for very specialized areas of practice or patient populations that they serve. And specialists can also include other professions. It's not uncommon to see pharmacists included in an eConsult service. And some systems also include nurse practitioners as specialists. And these services can be synchronous, which means they occur in real time, so such as through video conferencing, and they can be asynchronous, which means they don't occur in real time, like sending an email. So if I want to send an email to someone, I don't have to set up an appointment for them. I send it and they get back to me when they can. And eConsult services can even use a combination of both. Now, the Champlain Base eConsult service that I study is asynchronous. And with the Champlain Base service specifically, they do ask specialists to get back within a week, but on average the response time is 2 days, which is quite fast. So now that we have an understanding of what I'm talking about when I say eConsult, let's talk a little bit about learning and eConsults. So there's quite a bit of literature out there on eConsults, talking about many of the various benefits, with access to care being a huge one. So in Canada, we have some very long wait times to see specialists. And there's a really great video on YouTube where Dr. Claire Liddy, who is a family doctor and a co-founder of Champlain Base, describes how discussions surrounding these wait times with Dr. Erin Keeley, who is an endocrinologist and the other co-founder, how this discussion was really the impetus for them to create the Champlain-based service. And I'll link that video down below because it's pretty cool hearing how they came up with this. There's also evidence of cost savings, and I'll link some open access articles down below for anyone who wants to read a little bit more on this. Now, there's also evidence surrounding the educational value or educational opportunities for eConsults, which is the research branch that I am most interested in here. So this benefit has been raised by both primary care providers and specialists within the literature and through our own discussions and research that we've done. And often this educational value is a motivator for them to participate in services like this. There's a number of different ways that we can look at this, and there's so many different theoretical lenses that we could employ here. The article that I had my class read this week by Erin Keeley and collaborators shares a 4-level framework for experiential learning made possible through eConsults, which I'll stick up here as I talk about it. So at the center we have primary care providers, and this focuses more on reflective practice and practice-based learning. Then there's electronic communication with a medical specialist, which focuses more on discourse and reflection. Then creating social networks, which focuses on building rapport and relationships. And finally, implications for educational practice, which focuses on program planning and maintenance of certification. So I'm probably going to hit on all of these as I'm talking today, although I probably won't talk as much about social networks. Not that this isn't important when we're talking about learning, but I somehow need to contain this video so it is manageable, and talking about this part didn't have the best alignment for the module I'm teaching this week, so perhaps more on that in a different video. I'm also going to talk a bit specifically about how we can look at the eConsult process itself through an experiential learning lens. So with that, let's get started at the center here and talk about primary care providers, specifically looking at experiential learning and reflective practice for primary care providers. So in my experience, a lot of time when I bring up this idea of learning from electronic consultations, what people think of first is primary care providers learning from eConsults. Because when you think about it, it kind of makes sense. The primary care provider encounters something in practice, they have a question, they ask the specialist responds with an answer. And one of the ways we can look at it through more of an educator theoretical lens is to look at this whole process through experiential learning. So we've covered experiential learning in my course this semester, and I have a short video on it somewhere on my YouTube. For those of you who aren't my current students, I'll link it up here or down below if I remember. But specifically here, we're talking about the work of David Kolb. So Kolb sees learning as a process where knowledge is created through the transformation of experiences. And Kolb proposes that knowledge arises from the amalgamation of grasping experiences, where one is taking in information, and the subsequent interpretation and action, or the transforming experiences. And some of you may already be familiar with Kolb's learning cycle, which is a recursive cycle that has 4 stages. So there's concrete experience, which occurs in the experiential world, reflective observation, wherein the learner makes sense of that experience, abstract conceptualization, wherein the learner is extracting what they've learned, considering what it means to them, and then assimilating it into their existing knowledge, and then active experimentation, wherein they try out what they've learned. And our article by Keeley and colleagues talks a bit about applying this experiential learning cycle to electronic consultations specifically. So here we have the primary care provider having a clinical experience, and they write a question for the specialist. The primary care provider considers the specialist's advice. The primary care provider extracts what they've learned and what it means to them, and they assimilate this into their existing knowledge, and they come to an understanding. And then the primary care provider implements the specialist's advice into their practice. And as a quick aside here, I will note that just because a primary care provider has sent an eConsult doesn't necessarily mean that there's a knowledge gap. For example, it's entirely possible that they or the patient may be just looking for some reassurance. So as you can see, we can think about eConsults as learning. And this communication back and forth from the specialist can result in new or refined knowledge for the primary care provider, which is rooted in their clinical practice. So it may be something that's new to the primary care provider. It could be a refresher in an area of practice that perhaps they haven't dealt with in a really long time. And this information may be transferable to other patients with similar conditions or similar medical histories, and this can expand the primary care provider's ability to manage complex patients in the future. And in a similar vein of thought, we can also think about learning from eConsults in terms of reflective practice. So reflection is important to professional practice because it allows professionals to reflect and consider whether they should opt for different action or response in future should a similar situation occur. And I was fortunate enough to get to be part of a study where we were developing reflective learning tools for primary care providers and specialists that document and reflect on their learning from eConsult exchanges. So we got to go through the whole process of developing and testing and piloting these tools, which is really fun. I know, a little nerdy. So in the pilot process, 52% of the reflective learning tools that were submitted by primary care providers indicated that they had learned something new. And in 42% of these reflective learning tools, they reported that they were going to use this information to manage the patient differently. So a PCP could reflect on that particular case, which was the case, I believe, with most of these reflective learning tools. But a primary care provider wanting to reflect on their eConsults could also reflect on their eConsults to see if there's an area where they have a learning gap and they may want to do some subsequent continuing professional development. For example, they may notice that in their eConsults over the past year, they have asked a lot of questions on cardiology or maybe psychiatric medications, and this may be an area that they then decide they would like to do some further courses on, workshops, or maybe do some more readings. And in that same study I mentioned that I got to be a part of, in the reflective learning tools submitted by the primary care providers, 23% of them described feeling motivated to go after some additional learning, which is really neat. And this back and forth that we get between both providers can result in transformed perspectives for both providers. So for example, maybe a primary care provider responds to the specialist's initial response saying, "Oh, but the patient is also taking this medication," which results in more dialogue. So we can also look at specialists learning from eConsult exchanges. And yes, specialists can learn from eConsults too. I don't think this is something we think of as commonly when we think about learning in this area, but it does occur. In that same study where we were piloting the reflective tools, 26% of the reflective tools that were submitted indicated that the specialist had learned something new from that eConsult. For example, something that came up in my interviews and has come up within the literature is that sometimes specialists want to look something up before they write their response. And the specialists that I've gotten to interview about this have mentioned that sometimes they want to make sure they're giving the most up-to-date information. For example, is the guideline they want to share actually the most up-to-date guideline? And primary care providers may also ask questions that the specialist doesn't see as much in their day-to-day practice, perhaps due to a level of complexity. So maybe it's a type of case that typically would just stay in the realm of primary care and doesn't normally actually come into the specialist's office. And another area which may prompt them to engage in reflective practice is if there is an eConsult case that results in an unexpected outcome, or perhaps there are certain question types that the primary care providers haven't been very satisfied with their response for, or they could have some eConsults that they didn't receive very positive feedback on from the primary care provider. So you now may be thinking, okay, Rachel, that's all well and good, but what do I do with this information as an educator? Well, we're going to discuss that now. So we're going to look at this through more of a continuing professional development perspective, because that's what I do for my work, but there are certainly implications for undergraduate and residency programs, and I encourage you to discuss this amongst yourselves. So for those of you who are not healthcare professionals have to engage in continuing professional development to maintain their license to practice. Specifics of this vary by profession, country, regulatory body. For example, CPD requirements for nurses in Canada and the US are quite different. So to lead into this whole issue, I want to introduce this fabulous article by my supervisor, Dr. Archibald, and some colleagues, which highlights some of the issues that we see within continuing professional development, or CPD, within medicine, and the potential here for continuing professional development. So if you find the following discussion interesting, do check out this article. So when we're talking about CPD, often needs assessments are done to determine the types of continuing professional development that are going to be offered, such as surveys and focus groups. However, these can have a number of issues. For example, when looking at physicians, some studies have reported poor response rates, overrepresentation of really topical issues, and physicians tend to not self-assess well, and they tend to pick CPD courses on things that they're already very familiar with. And as a disclaimer, I'm not saying that other health and social care professionals are any better at this. These studies just looked at medicine. So some authors, including this article, have suggested that point-of-care questions, which eConsult falls under, could be a more accurate way of looking at the learning needs than more traditional types of self-assessment we may use. So with point-of-care questions, like eConsult, the provider is reflecting in their daily practice about whether they need to stop and ask a question, and if necessary, doing so. And looking at point-of-care questions also gives us an idea about what the primary care providers are encountering in their daily practice, and what questions are arising in their workplace. So this isn't just someone trying to remember retrospectively in a survey or a focus group what's come up recently in their practice. These moments are captured when the primary care provider pauses in their practice to ask a question. So as an educational researcher within the realm of continuing professional development, for primary care providers, this to me is some very powerful and useful data, and it can also be useful for CPD planners. So we can use these referral questions, like the ones used in eConsults, to determine practice-based learning needs of primary care providers, rather than relying on these things like surveys and planning committees to determine these needs. These eConsult questions are coming straight from practice. And from eConsults, we also can learn a lot of other things, like what specialty groups these questions are being sent to, like dermatology, psychiatry. We know what the professional groups are of the providers, so was this a family physician, a nurse practitioner, physician's assistant? And we can also see geographical region, which can allow us to tailor our continuing professional development activities. So for example, there could be differences between the learning needs of a nurse practitioner and a family physician, or rural versus urban practice. And I have an example here of this from Psychiatry. One of the things we looked at with this article was clinical topics. So what was the eConsult about? So I'll put up here the top 5 clinical topics that we found. So these were depressive disorders, anxiety disorders, neurodevelopmental disorders, bipolar and related disorders, schizophrenia spectrum, and other psychotic disorders. And there were other clinical topics, but they were all under 5% each. So as we can see by looking at this, 30% of these eConsult cases that were going to psychiatry were about depressive disorders. So as someone in continuing professional development, that makes me wonder, is there a knowledge gap here that we need to address? Something else that we looked at here in this study was question type, classifying them as drug treatment, clinical management, diagnosis, or no specific question. And here about 76% of the questions were about drug treatment, and we further broke this down. So drug treatment questions could be, for example, about drug of choice, adverse reactions, drug interactions, etc. And as you can see, a little over half of the drug treatment questions pertain to drug of choice. And that contributed to 39% of the questions asked overall. So the most common questions pertain to drug treatment, particularly choosing, augmenting, and switching between medications like SSRIs, SNRIs, and first and second generation antipsychotics. So as an educator, that makes me wonder, is there a need for some continuing professional development here, whether it's a full-on knowledge gap or just a need for a bit of a refresher? And as I mentioned earlier, just because someone is asked an eConsult doesn't mean that there's a need for CPD. A primary care provider may have been seeking reassurance, or it's also entirely possible that the specialist adequately answered their question and they don't need further learning on this topic at this time. Something else interesting we can do with this data as educators is compare eConsult cases to continuing medical education or CME minutes. So this data is from a presentation I did, I think back in 2016 at Briere. I still think it's an interesting one to look at though as educators. So the data here is a bit older, so don't worry about that too much. The takeaway here I really want is just how we can use data like this rather than this specific data on the screen, if that makes sense. So in this chart, you can see the percentage of eConsult cases pertaining to each specialty area as compared to local CME offerings for 2012 to 2014. And here we're just looking at Champlain-based eConsult service. So as you can see here, there are some differences. Cardiology in particular stands out with a large percentage of CME minutes being offered dedicated to cardiology, while the number of eConsult questions, although still high, is considerably less. And of course, a discrepancy like this gets my researcher's senses tingling, because I want to know what's going on here. So if we continue using cardiology as an example, we can see that the top 5 content areas for eConsult questions and CME activities also differ. So while we do see atrial fibrillation, anticoagulation appearing on both the lists, we can see here that there is a discrepancy between the questions the primary care providers are asking and the CME that we're offering. And this graph further highlights this issue. So while some content areas are very close, such as chest pain, we still see some large differences. For example, heart failure accounts for nearly 15% of continuing medical education minutes, but only about 3% of eConsult questions. Contrastingly, questions pertaining to coronary artery disease contributed to almost 18% of eConsult questions, but a little less than 5% of CME minutes. And to highlight once again, just because a question's asked doesn't necessarily mean we have to have CPD on that topic, because maybe there isn't a knowledge gap, but it's still something to keep in our minds as educators because this is giving us a snapshot of the questions that primary care providers are asking in their daily practice. So eConsults can offer an opportunity for us to optimize continuing medical education and CPD more broadly for other groups using eConsults like nurse practitioners to reflect potential learning needs that are identified through eConsult questions. And that's all for now, folks. I hope you enjoyed learning about eConsults, some of the learning that's going on through eConsults. It's certainly a topic I am very passionate about, but let me know if you have any questions. And as always, I will see you all online. Bye.